Less than a year after announcing his ALS diagnosis, actor Eric Dane has died. He was best known for his roles as McSteamy in Grey's Anatomy and Euphoria. In his final months, he focused on raising awareness about ALS, which is also known as Lou Gehrig's disease.
9 News medical expert Dr. Paul Coley joins us to talk more about ALS. Talk about specifically with Eric Dane, some of the symptoms that he was suffering from and kind of the course that his illness took. Because we heard about it in the news and then it just seemed like, I don't know, I just thought we had more time.
Yeah, it was very sudden. I mean, you know, his course was very typical actually. And what he described in Instagram post was actually that he first started noticing some weakness in his right hand. And he thought perhaps it was from too much texting. And then he would be out at an Asian restaurant holding chopsticks and his chopsticks would, you know, he would have weakness and he would drop the food. And then that really progressed to more symptoms, really having asymmetric symptoms, losing control on one side of the body almost completely. We then started to see involvement of his speech. So there was, I think, he did an appearance where you could hear a slurred speech. You can start to have vocal cord dysfunction. So a very classical course where you see a rapidly progressive basically motor symptoms, but you can also have other what's called bulbar symptoms, which are the voice symptoms and, you know, the swallowing and that type of stuff that can happen within the course of a few months to a couple of years.
And, you know, young, in my opinion, in great shape. I'd seen him at the Global Down Syndrome Foundation event like months before.
Really?
Wow.
Yeah, really, yeah. And yet you say, okay, this diagnosis happens. So many things we hear about, like, oh, catch it early and we can do more. How come I never hear that about ALS?
Because it's really hard to catch it early until it becomes symptomatic. There's no blood test, there's no imaging test, and only 5 to 10% of cases actually run in families. The rest are what's called sporadic. So 90 to 95% of cases just kind of happen. And so you don't know who's going to get it. We think it's some kind of a toxicity, essentially a culmination of your genetics, your environment, and perhaps a toxic exposure. We do know that military vets, there's an association there that can happen. There's an association with smoking that can happen. Men have a slightly more preponderance until menopause when women start to catch up. But really between your middle ages, kind of the 30 to 40, 50, 60 is when you see most people present with symptoms. And unfortunately, within 3 to 5 years, that's the median survival. It's pretty much fatal at that point. And it's a really tough disease. It's called Lou Gehrig's disease. And essentially what happens in the brain and spinal cord, you get dysfunction of your neurons at all levels. So the brain, you start to have cell death of the neurons. They're not working, almost like your computer shutting down. The spinal cord, which carries the signal, starts to have cell death as well. And then the muscles themselves misbehave too. So they don't even receive the proper signal. So you essentially have dysfunction at all levels. Now there's some theories as to why this happens. One is excess neural inflammation. So again, those environmental exposures causing inflammation. Even repeated head trauma has been sort of implicated potentially in Lou Gehrig's disease. But the second is too much excitement of those neurons. So it's called an excitotoxicity. When the neurons are firing so much, they're kind of burning out, and that's what's causing the cell death.
I mean, you described over 90% being sporadic. How do you even diagnose something like this?
It's very difficult, Alex, extremely difficult to diagnose. And unfortunately, the first symptoms then lead to diagnosis. So in Eric Dane's case, he actually had 9 months between his first symptom and his diagnosis, because this is a common story. You go from specialist to specialist, you start getting worked up for everything else that's more common, and then you end up at ALS as almost as a diagnosis of exclusion. You can do tests on the muscles, you can do MRIs, you have to rule out all the other things that it is. But really, it is a very difficult diagnosis. But the take-home message I want people to get is don't say, oh, I won't get it, because we've seen people get it at all ages and stages of their life. And if you notice something, like you're dropping something repeatedly, don't ignore it and just say, I'm being clumsy. You really want to get it checked out. Now, the thing with ALS is you don't get a lot of sensation symptoms. You don't get tingling, you don't get numbness, you get more motor symptoms. And about half of people may have some cognitive issues, which may potentially impair their ability to know that something is happening. But if you see a family member dropping something over and over again, being clumsy, make sure you see a neurologist and get it checked out.
Well, I'm glad you shared that information. I know when the ALS challenge happened, that ice bucket so much was raised for research, but it's still never enough. And for anybody who's going through it, it's going to never be enough. But thank you. Thank you for educating us.